Dr. Griffin is a pain physician here at HSS, and he earned his MD and PhD from Harvard Medical School. He specializes in evaluating and treating low back pain, sciatica, disc herniation, and neck pain, as well as other musculoskeletal, sports injury, and spine-related conditions with non-surgical management approaches. Dr. Griffin sees patients at HSS 75th Street campus and also at the newest HSS location in Hudson Yards. So now, without further ado, I will turn it over to Dr. Griffin. Thank you so much for being here to share your expertise with us.
Thank you very much, Maggie. So I'm going to be talking tonight about the sources of back pain. Where does back pain come from? As Maggie mentioned, I'm working at HSS. I see patients both at our office in the Upper East Side and at the HSS Hudson Yards brand new office. Here are a few photos of the waiting area and the physical therapy office in the location. So in the talk today, I'll be giving a brief overview of some of the scientific aspects of pain, how the nervous system detects and responds to painful sensations. Then, mainly from an anatomy standpoint, I'll be talking about common types of low back pain, as well as sciatica, pain radiating down the leg. So to start with, what is pain? Recently, the International Association for the Study of Pain has published a revised definition of pain. Pain is an unpleasant sensory and emotional experience associated with or resembling that associated with actual or potential tissue damage. And one thing to notice about this definition is that pain is really a subjective experience of a person. The neuroscientific view of pain will often focus more on nociception, which is how your nervous system responds to noxious sensory stimuli, painful heat, painful mechanical stimuli such as being pricked with a pin and so forth. Whereas the full definition of pain includes everything a person experiences in the process of being in pain. People have been interested in pain for as long as there have been people. One of the earliest historical or scientific views of pain was described by René Descartes about 350 years ago in his treatise on man, where he described pain sensation almost like a bell pull, where a stimulus going to the foot, like the fire, would then be perceived as activating a response in the brain. Really is a very linear connection between the skin and the brain. The neuroscientific view of pain is informed by the 350 years of science that has been studied since then. So we know there are a lot of important structures in the nervous system that are involved in pain sensation. First, the peripheral nerves connect the skin to the central nervous system, and they bring information about pain essentially into the central nervous system. The peripheral nerve has a peripheral nerve ending, and then joins a spinal nerve, which enters the spinal cord, where a second nerve cell then sends that information up through the brainstem to the brain, including centers in the brain involved in the sensory experience of pain, and other centers in the brain that are probably involved in the emotional and subjective aspects of pain. At each of these levels, the response to pain can be regulated by the nervous system, so it's much more complex than a simple bell pull type of response. In the skin, or in the nerve ending in the skin, there are a wide variety of different receptor proteins that nerve cells use to detect things as painful. There are specific receptors that respond to heat at different temperatures, that respond to cold at different temperatures, that respond to acid, which is released when there is tissue injury. There are receptors which respond to mechanical force, and receptors which respond to other chemicals that are also released associated with inflammation or with tissue injury. That information is conveyed by the sensory nerve to the spinal cord. In the spinal cord, the first nerve receiving the pain information transmits that information to the next nerve cell in the spinal cord at a connection called a synapse, where a neurochemical signal is released by the primary neuron to the secondary neuron. And depending on the nature of the pain stimulus, that can change very much how the second neuron responds, over time. Normal nociceptive pain, where you respond to things that are normally painful, involves simply a painful stimulation, activating the primary nerve, and then stimulating the central nervous system response. So when there's no stimulation, there's no nociceptive or no pain response. Light touch also doesn't activate this pain sensing system of the nervous system. On the other hand, high intensity stimuli will then activate a normal nociceptive or painful response. That changes in situations of inflammation or nerve injury. Inflammation is your immune system's response to tissue injury. So sunburn, a skin cut, surgery, all of these things will evoke an inflammatory response where immune cells which are involved in the wound healing response will release chemical mediators that sensitize the nerves. In those situations, there's little element of spontaneous pain, but events which were previously perceived as non-nociceptive or non-painful will be responded to as painful cues, and previously painful stimuli will be perceived as even more painful. And I'm sure all of you have experienced that. If you've ever cut your skin and gently touched the area around the skin cut, you'll find it much more sensitive than is typical. Finally, there's a state of neuropathic pain in which the nervous system itself is injured or inflamed. And in those situations, the pain sensing system itself can be hyperexcitable. That can result in spontaneous pain where pain can be felt without stimulation. And then the same phenomena of light touch becoming painful and painful touch becoming more painful also characterizes a neuropathic pain state. I'll shift gears now to talking a little bit about back pain. Back pain is everywhere. I imagine many of you have experienced back pain. Back pain is responsible for about 2% of physician office visits. It's about the 5th most common reason for people to visit their primary care doctor, and it causes a major socioeconomic burden in the United States and throughout the world. For example, in both 1990 and 2010, low back pain was the leading cause of years lived with disability in the United States. So I'm going to now do an overview of different types of back pain. One of the major kind of classifying schemes in back pain is to talk about either back pain which is in the back or pain which comes from structures in the back, but it refers to the leg or some other part of the body. And that will commonly be called sciatica or more technically lumbar radicular pain. This picture kind of gives you an overview of some of the major anatomic structures in the back. So in the superficial muscle layer, you can see the upper back muscles of the trapezius anchored to the cervical spine and the neck and radiating down to the mid-back, the large mid-back muscle, the latissimus dorsi, the erector spinae muscles, which are involved in postural support, the external obliques, and then this useful landmark, the iliac crest, which is the bony prominence that you can easily feel on the side of your hip. So as you can see, the back is composed of sort of this complex network of muscles that will commonly be their own source of back pain. Underneath the muscle layer, you have the rib cage, the shoulder blade in the upper back, and the lumbar spine with its 5 spinal segments, L5, L4, L3, L2, L1, labeling the vertebral bodies, and then the sacrum at the bottom. One common type of back pain is myofascial pain. This term refers to soft tissue pain in the low back, generally including both pain in the muscles and pain in other types of connective tissue in the back. Myofascial pain can affect just one muscle or several in a body area. Acute muscle pain can occur after strain or spasm. It can cause a painful sense of cramping in the neck, of stiffness, and the inability to turn it, for example. It can occur after overloading a muscle. Chronic muscle pain is another commonly encountered problem. Unfortunately, not one that is real well understood. In some cases, chronic muscle pain can occur as a result of a muscle disorder, but in other situations, it occurs in association with other painful conditions of the back or neck, Or finally, there can be muscle pain, which affects almost the whole body, characterized as, with the term fibromyalgia. Moving on from myofascial pain, I'm going to look a little bit more at the structure of the spine. So as I mentioned before, the lumbar spine, which we'll be focusing on the most in this talk, has 5 vertebral segments which make it up: L1, L2, L3, L4, L5, and then you get to the sacrum. In between the vertebral bodies are the intervertebral discs, which act as shock absorbers in between the vertebral body bones and confer flexibility on the spine. In the back of the spine, over here, I've zoomed in on what is termed the posterior elements, or the bony coverings on the back of the spine. Those bones articulate with each other at the lumbar facet joints. Here, for example, is the L3-4 facet joint articulating between L3 and L4, the L4-5 facet joint articulating between L4 and L5, and the L5-S1 facet joint articulating between L5 and the first sacral segment. And then over here is the iliac crest, which we marked out on the other picture. Lumbar facet joints are more formally called zygapophyseal joints, and they are the posterior point of articulation between adjacent vertebrae. They're a cartilage-lined joint surrounded by a joint capsule, just like many other joints in the body. They contain joint fluid, and they are a common source of back pain. Pain in the facet joints will typically show up as pain in the immediate paraspinal area, the area next to the spine on either side in the low back, often accompanied by pain referring to the buttock or thigh. Referred pain just describes pain which is from a different body part than the one that it is felt in. Acute pain in the facet joints is often experienced after rotation or twisting injuries, in which the facet joints are subjected to force and then become painful and inflamed, often temporarily. Chronic low back pain can also come from the facet joints, and that type of chronic low back pain from the facet joints is usually sort of due to wear and tear on the structures in the back. So the facet joints themselves, like many other joints in the body, can be affected by wear and tear arthritis or osteoarthritis, and that can be a painful condition. It's also likely that when people develop disc degeneration, where the intervertebral discs in the back degenerate over time, there may be more load on the facet joints, and that may also contribute to facet joint pain. The typical location of facet joint pain, as noted, is typically in the low back, in the area of the affected facets, and can be felt on either or both sides of the spine, sometimes with radiating pain to the upper part of the legs or the buttocks. Facet joint pain can actually affect any part of the spine, all the way from the neck to the sacrum. It's by far the most common in the lumbar spine, or in the neck and the cervical spinal facet joints. Another common type of low back pain affects the sacroiliac joint. The sacroiliac joint is a large, relatively mobile joint where the ilium articulates with its sacrum in the pelvis. This joint acts sort of as a stress relief joint, most likely in the pelvis, and it's also a point of transmission of people's body weight from the spine and the torso to the legs. It's relatively poorly understood why people get sacroiliac joint pain in most cases. In a small proportion of cases of sacroiliac joint pain, the pain may be due to a systemic inflammatory disorder, a type of autoimmune disorder which can involve the spine. Typically, sacroiliac joint pain is localized to the sacrum, where the sacroiliac joints are located, just beneath the iliac crests in the area of what's called the posterior superior iliac spine, right on top of the sacroiliac joint. Not uncommonly, this pain will also radiate to the upper thigh, the back of the upper thigh, and almost never will it be referred to the area of the leg below the knee. These are 3 of the most common types of low back pain, which I've discussed: myofascial pain, facet joint pain, and sacroiliac joint pain. I don't really go into it in detail, but it's also possible to get pain from the discs themselves, which is referred to as discogenic pain. It's important to keep in mind that back pain is not only from structures in the back. So just like back pain can be referred to the legs, pain from other body structures can be referred to the back. For example, kidney stones or endometriosis commonly show up as back pain. Vertebral compression fractures are another type of back pain. Compression fractures primarily affect people of older age or people affected by osteoporosis, and are fortunately typically a self-limited but very painful condition. And finally, cancer involving the spine can manifest as back pain as well. Rarely back pain can be the presenting symptom of a new diagnosis of cancer, although that's really quite unusual. That is to say, among all the people who one sees with back pain. Okay, so I'm just going to recap slightly. So far with the sources of back pain we've been talking about so far, most of the back pain has involved either nociceptive pain, where there's normal pain stimulation, or inflammatory pain, where people may have inflamed facet joints or an inflamed sacroiliac joint, which is perceived as painful. A lot of the rest of the talk, I'll be talking about what's more considered neuropathic pain, where the pain results from irritation or injury to the nervous system. This diagram demonstrates some of the major nervous system structures in the low back. So inside the vertebral column is the spinal cord. The spinal cord ends in most people at L1 or L2 at what's called the conus medullaris. And then the spinal nerves continue to descend within the spinal fluid in what's evocatively called the cauda equina, or the horse's tail. The spinal nerves will then exit the spine at each corresponding level. So the L5 spinal nerve will exit through the L5 S1 foramen or opening. The L4 spinal nerve will exit underneath L4, and so on. And then as they leave the spinal nerves will sort of recombine in nerve plexuses to form nerves that then travel to the extremities. So here is the sacral plexus, which comprises several of the lumbosacral nerve roots, forming the sciatic nerve that goes down the back of the leg. This is a zoomed in picture of spinal anatomy. Focusing on this picture on the left, this is a diagram of the L4 and L5 vertebral bodies, which contact each other at this L4-5 intervertebral disc. This opening is where the L4 spinal nerve exits the spine. This is where the collection of nerve cell bodies are that give rise to the spinal nerve fibers traveling out. And what's striking about this is the close proximity between this disc and the nerve as it exits, and in addition that this nerve exit, besides the disc, is confined by largely rigid bony structures. Then we'll move on to this picture, which kind of diagrams a disc herniation, or herniated nucleus pulposus. The discs are composed of a fibrous ring, which surrounds a softer or gelatinous type of soft tissue inside called the nucleus pulposus. When a disc herniation happens, some of the nucleus pulposus material finds its way out through an opening in the annulus fibrosus. Even a small amount of herniated disc material can provoke an intense inflammatory reaction by the body, which results in the release of inflammatory chemicals which sensitize the nerve to pain. Even without severe nerve compression, disc material can be quite irritating to nerve roots. When a larger disc herniation occurs, there can also be mechanical compression of the nerve, particularly in the foramen or opening where the nerve root exits the spine. A disc herniation, which affects one nerve root in this manner, will commonly cause pain in what's called a dermatomal distribution. Specific areas of skin are sensed by single spinal nerves. Those areas of skin are called a dermatome. So for example, you can see in this diagram, this is the L4 dermatome, kind of wrapping down the front of the leg over the knee to the front and inside of the shin, essentially. A disc herniation near a single spinal nerve will usually cause pain affecting a single dermatome. So people with sciatica or disc herniations will commonly get pains shooting, for example, down the side of the leg to the ankle and the top of the foot, or down the back of the leg to the bottom of the foot. Larger disc herniations can affect several spinal nerves and can cause pain in multiple dermatomes. That can most easily be seen if we go back to this figure. So this is sort of a small disc herniation. If you can imagine a larger amount of disc material escaping, it could actually occupy this whole area of the spine and possibly impinge some of the other nerve roots inside the spinal canal as they descend past the affected disc level. And so just to go back to the terminology a little bit, so sciatica is a description of a symptom. It refers to pain in the distribution of the sciatic nerve, which in general is the back of the leg, the back of the calf, and the bottom of the foot for the most part, and also the top of the foot. Radicular pain refers to pain in a spinal nerve distribution. So there's a lot of overlap between sciatica and radicular pain. Radicular pain is a more general term, if we go back, because that can encompass, say, pain affecting the L3 nerve root or pain affecting the C8 nerve root, which would obviously be not correct to describe as sciatica. Radiculopathy is a related term you'll sometimes hear doctors use. Radiculopathy refers to loss of spinal nerve function as most people use it. So radiculopathy will usually refer to numbness in a dermatomal distribution or loss of motor function related to nerve compression, because most of these nerves are mixed nerves which involve both sensory and motor function. So a disc herniation is a relatively acute process in many cases, which will typically affect people between in their 20s to the 60s. As people go through life, there can also be chronic wear and tear on the spine that change the structure of spinal vertebral segments. And these will result in some of the other terms that many of you may have heard in the context of talking about back pain. One of them is spinal stenosis. Spinal stenosis refers to narrowing of the central canal of the spine. Spinal stenosis will usually result from a combination of disc degeneration, which will narrow the spinal canal from the front, and change in the structure of the spinal ligament, ligament changes, which will narrow the spine from the back. Arthritis affecting the facet joints can also narrow the spinal canal from the sides. So together, all of those factors will result in central spinal stenosis, which will commonly cause sciatica pain as a symptom. Foraminal stenosis is a similar term, which refers to narrowing of the exit paths for the nerve roots, commonly by disc herniation or by arthritis of the facet joint and related bony outcroppings, or both. These will tend to cause more chronic pain when there's arthritis-related foraminal stenosis or when there's central spinal stenosis. Chronic pain, which most commonly occurs sort of in a waxing waning pattern over years. It's important to keep in mind that the symptom of pain shooting down the leg, while it's most commonly caused by disc herniation, spinal stenosis, or related problems, can be caused by many other underlying disease processes. One of the more benign of these is piriformis syndrome, in which a spasmed buttock muscle can irritate the sciatic nerve at its exit point from the pelvis and cause pain shooting down the leg. Shingles is a viral reactivation syndrome, which can cause pain and severe pain hypersensitivity in a dermatomal distribution. Cysts or masses that compress a nerve elsewhere than the spine or within the spine can cause sciatica symptoms. And then finally, disorders of either the peripheral nervous system or the central nervous system can cause symptoms which are very similar to radicular pain. So to summarize, the nervous system regulates how incoming sensory stimuli are processed. There can be both suppression and sensitization to pain. Low back pain in the low back usually involves the muscles or joints in the lumbar spine, or possibly the discs in the lumbar spine. And then finally, sciatica symptoms usually result from altered function of the spinal nerves in the back. that essentially concludes my talk. Thank you everyone for listening.